Hi there, it's Mary with MRP, and we are live at Ducharme Dermatology. And I'm here with Dr. Erin Ducharme, board certified dermatologist, and we're doing some advanced training with our Luvo Lucent on the Darwin platform. And we're treating a lot of really fun patients today, lots of vascularity, pigment, facial rejuvenation, and we're just wanting to learn more as a group and making it a collaborative effort. But I'd love to ask, how are you using your IPL in the practice?
Well, I would say that we consider IPL to be really foundational for anyone's anti-aging treatment plan. Obviously, skin type, has to be assessed, but we see all ages, and there really isn't an age group where I wouldn't say this needs to be part of your plan moving forward. We know that it helps treat when someone has problems, but even for those young patients who are just starting to think ahead, it is a great place to get started. Pair that with some SPF, a hat, maybe a little retinol, and you can have a really simple regimen. Now, as we get into some folks as they age a little bit and they start to have a few more problems like the seborrheic keratoses, the telangiectasias, the dyschromias, IPL also has a role there as well. So I tell patients that it's a great way to treat some of your problems, but also to prevent some of the, creepiness that happens over time. I would say our flagship way of using our IPL is in what we call a PE series. And PE stands for Physician Enhanced. And it is a collaborative technique that we do between myself and my PA or myself and one of my estheticians. And it is ideal for those patients that, again, are coming in with a little bit more stubborn lesions where an IPL alone is not going to suffice. Like we need some cryotherapy. We need to use like our Erbium Photona laser, which we also recently purchased. I'm using electrocautery. I have several tools at my disposal. So I tell patients, I'm intentionally vague with you because we're going to do what you need. And our final outcome is going to be clear skin.
Right.
But I've got a lot of ways to get you there. And we roll our IPL, we weave that into that treatment series. So it's a series of 3, typically once a month. And the initial appointment is typically going to be, again, the cryotherapy. Let's get those spots. Let's use our electric cautery. Let's use our Nd:YAG from Photona to get some of the more stubborn, larger vascular lesions on the face. And then we're going to do some sort of resurfacing. Again, lots of tools for that. We have a Bella ND that we got from Scott Carson at MRP. That is a great device that helps with resurfacing. Our new Photona laser, we can do an ultralight peel. That's another way we can work on resurfacing and blending. And so after that session, we say, come back in a month. Now we've helped strip off some of that stratum corneum. We've gotten a head start on getting rid of some of these lesions. And now we can go in with our IPL. We know we're going to get a more effective, robust result because we have prepared the skin. And now we can go in and we can do more blending. We can get more brightening. We can focus on that collagen stimulation.
Right.
And pictures speak 1,000 words. I am really hoping that you're going to share some of our before and afters. We're not using IPL in some of our darker skin tones, but this combined, package, we are treating our fits 4s and 5s and having some excellent results.
It's fabulous. She has showed me personally these before and afters. I'm so excited to share these, especially to our dermatology community. These are really impressive. And what I love most about what you're doing is you're customizing treatments for patients. They feel taken care of. They're seeing the results for themselves. And that's kind of similar to the tone and tune of Luvo and the Lucent, that you can customize your IPL to all of your patients.
I do think that one of the advantages of seeing a board certified dermatologist is you are going to be able to customize. You're not going to a med spa where they have one hammer and everything is a nail and everyone gets the exact same treatment.
Absolutely.
The other advantage is that I'm able to diagnose the issues. And so we can get a tailored, appropriate treatment plan that is going to be more holistic with a WH.
I
Yes.
love that. That's so much fun. Ah, I want to be a patient. Do we have time?
Yeah. Well, okay. One other thing we're really excited to add to our treatment offering. We do a lot of acne here, of course.
Mm.
And so a very, very popular service we have called it our deep cleansing peel. And I have a nurse who is a former esthetician. And so she's kind of level up in terms of her ability to offer and get more aggressive.
Yeah.
And so she will use a little 11 blade or a little 18 gauge needle, and we're going into those deep comedones. We're going over and doing a salicylic acid peel.
Yeah.
Sometimes we're using our Fotona for an ultralight peel to blend too. That can help. But then what we've decided to do in the last couple of weeks is to layer in that IPL. So we're going through Teresa. We actually were just talking about this. Teresa is a world-class trainer. Thank you, Teresa, for coming out. We learned so much from you 2 weeks ago it was absolutely incredible. We are so grateful for that. But she really helped to encourage us to start using that more for our inflammatory acne. And it was something we had available, but we just weren't utilizing. So
Sure.
we've already started taking advantage of it in the 2 weeks since she was here. We are telling people it's kind of a level up. It's a little add-on service to your deep cleansing peel. We're going in and we're killing that Proprioni's bacterium with that 430 toning pass that she suggested. It seems to be very well tolerated. And most patients have said, yeah, I want to add that on.
So helpful. That's
Yes,
great.
yes.
Well, lots of advanced training from MRP,
Yes.
from Fotona, Lucent. I'm excited to be here, and we have a couple more patients lined up on the books today. I think right now we're treating some pigment, some vascular,
Yes.
and maybe ending the day with a little acne treatment. So I'm so thankful to be here, and thanks for sharing. And we'll share our exclusive advanced settings that we are learning about today after the week is over. And so thanks for tuning in.